Mealtime is more than a bowl of food. It's the foundation for a long and healthy life. At Wellness, dry recipes are crafted with the highest quality natural ingredients for a taste that pets love, and scientifically proven through AFCO feeding trials to ensure that every complete and balanced meal supports the 5 signs of well-being. With Wellness Pet Foods, pet parents can share a life of well-being together with their pet.
You're listening to Veterinary Vertex, a podcast that AVMA journals. In this episode, we chat about how ocular examinations before and after total ear canal ablation and bulla osteotomy can help recognize and prevent potential vision-threatening abnormalities in cats and dogs with our guest, Bianca Hartrum.
Welcome to Veterinary Vertex. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today we have Bianca joining us. Hey, Bianca, thank you so much for being here with us today.
Thanks for having me. I'm excited to be on here and talk about the paper.
All right, let's dive right in. So, Bianca, your JAVMA article discusses how ocular examinations before and after total ear canal ablation and bulla osteotomy can help recognize and prevent potential vision-threatening abnormalities in cats and dogs. Please share with our listeners the background on this article.
So this is my residency study that I completed at my residency at MedVet in Ohio State. In the study, we performed ocular examination in dogs and cats before and after total ear canal ablation and bulla osteotomy, and then also after our VBOs in cats, just to kind of get a whole compilation of the different ear surgeries. So the idea for the study was sparked actually from a case very early in my residency. We were choosing what do I want to study? What do I want to invest all this time in a residency project in? And this dog came in with a really severe melting corneal ulcer and facial nerve paralysis after a recent Tikaboo. So we were wondering, how long has this issue been going on before we saw this dog? Did the dog have eye disease before it had ear surgery? And how many cats and dogs do have eye disease, either as a result of their ear disease or following their ear surgery? So afterwards, I dove into a bunch of publications, just trying to figure out, is this a viable study? And from everything I learned, every study mentions neuro-ophthalmic complications. There's several that mention eye complications, but really don't dive into the details. And none of those studies had any ophthalmologists involved. So we thought it would be a really great study to look into. Do these animals have eye problems, and what can we do to prevent eye problems if they did occur?
Yeah, very useful and very clinically applicable too.
Yeah.
So what are some of the important take-home messages from this JAVMA article?
Biggest take-home messages I would say is that patients should have eye exams. There were so many patients that developed eye complications, and all of our findings were more than in previous studies, I think, because we did have people paying really close attention to their eyes. So patients should have eye exams before and after ear surgery because the ocular and neuro-ophthalmic complications were so high. At minimum, they should have Schirmer tear tests to make sure that they don't have dry eye. They should have topical lubricants afterwards, protect their eyes because many develop facial nerve paralysis. And then no matter what, we should be fluorescein staining these patients. It doesn't take very long, just to make sure that they don't get they don't have a corneal ulcer, because that can lead to blinding complications in them.
Fabulous. So you might know, Bianca, I'm an equine orthopedic surgeon, but if I had to do it over again, I would do ophthalmology. I think it's fascinating. So I'm living vicariously through you right now. Okay. What sparked your interest in ophthalmology?
So I always wanted to be a vet, just like many of us. I think most of us kind of say, we always wanted to be a veterinarian because we love animals. But it really uniquely, it was general physics class. I was working as a veterinary assistant at a general practice in my college town and was in a general physics class, just learning about optics, lenses, how the eye worked. And I thought it was so fascinating. So I worked with a veterinarian, Heather Vanderbrink, and I mentioned to her, hey, it is so cool how the eye works and everything. And she's like, you can be an ophthalmologist and a veterinarian at the same time. And that was the first time I learned that I could do that. And kind of just, all the rest is history.
That's amazing. And mentorship is alive and well. And physics was probably my favorite class. So there you go. What do an equine surgeon and ophthalmologist have in common? I really like also what you said about, people mention this problem before, but then you did a deep dive into all the literature that existed and then formulated a question. I think that's an amazing gift to have. It's a natural gift to have, especially at a resident stage. So congratulations. That'll take you a long way. When you do studies like this, Sarah asked you earlier what were some of the most important findings, but there's always things that surprise us. What things surprised you by doing this study?
I think it was the sheer amount of cats affected. So almost all cats, it was actually 90.9% developed Horner syndrome. So it was such a high number that it was very surprising to us because all the previous literature said it was only up to 58%. So it was just very surprising that the complication was so high.
Yeah, I think cats often get overlooked sometimes, especially when we're looking at both like cats and dogs as far as companion animals go. So kudos to you too for looking at the cats in this study.
It was important to me to do that. I made sure I did a study where it included cats.
So what are next steps for research in this topic?
So we don't currently have any kind of future research planned on this topic. But I think the biggest kind of thing with this, it has changed the way that things work in our hospital. And it's improved our collaborative care at MedVet. So we created a new standard of care that includes pre and post-op exams included in the surgical cost for any patient undergoing ear surgery. So we have handouts on collaborative care for our clients when they first come in. All the estimates include all the eye exams. They can communicate with us. So it really has kind of changed the way we approach ear surgery. And we are paying attention early now to eye problems. And we encourage other multi-specialty hospitals to do the same. It's really been great. It's improved everyone working together in the hospital. And I think it's really increased the care for these patients.
Great to hear about that collaboration is to see too you putting like the findings from your study into action at your practice.
Yeah, it's been great.
So emerging technology is a very hot topic right now. Do you see a role for AI in this area of research?
I think that's hard to say now. I think the use of AI is going to be relevant in a lot of veterinary fields in the future. We're already seeing several studies for AI in ophthalmology as a successful tool to increase the accuracy of diagnosis. So a lot of machine learning, showing them photos, saying, is this a problem? Is it not a problem? So that could be used in the future. I think it's just it's really dependent on how much data we collect and how good that data is, because the models are only as good as we train them to be. So I think it's possible. It's going to be some time, but I think it could be a good thing in addition to all the expertise we have just to improve our accuracy.
I think you could say the same thing for medical records, garbage in, garbage out, right? That's why it's so important to have them be accurate and detailed.
Exactly. So that would be important, or else they're not going to be as useful as we'd like them to be.
And for those of you just joining us, we're discussing how ocular examinations before and after total ear canal ablation and bulla osteotomy can help recognize and prevent potential vision-threatening abnormalities in cats and dogs with our guest, Bianca.
Yeah, again, congratulations, Bianca, on getting all the way across the finish line a resident project. How has your residency training or any other previous work prepared you to write this article?
That's I've been thinking about this a lot. It's a hard question. So I think just the way the veterinary field works, all of us have it going into specialty, having to do a rotating internship and really learning at that stage collaboration between services. And a lot of us are fortunate to end up in hospitals where we do get to see such great collaborative care. So I think my training at, Virginia Tech helps me with that. I did several specialty internships after that before a residency and I think that really helped, being in different places and being in different hospitals and seeing how they collaborated. And I think a lot of those places really did show that it is possible. Ophthalmology works so much with surgery, with dermatology, with anesthesia. So I feel like that did really help me in preparation for this article. And I completed my residency at Ohio State and MedVet, and both those places had really great collaborative care. And I got kind of a combination of academic and private practice in that kind of really helped me with this article. Yeah.
Very good. Do you know about our resident awards?
I do.
All right.
Heard of it. Yeah.
Okay. So yeah, you can self-nominate. It's a rolling nomination on the JABMA and AJVR website. So we hope to see your article there.
Yeah.
Yeah, and to our listeners too, don't forget if you have a student, resident, or intern author, it is rolling, but we're looking right now for articles published in 2024, and we'll be looking to have all of this captured by March. So be sure to get your nominations in if you're tuning in. So Bianca, this next set of questions is going to be really important for our listeners. And the first one's going to be dealing with the veterinarian's perspective. So what is one piece of information the veterinarian should know about ocular examinations before and after TICA-BO and VBOs in cats and dogs?
So if I had to narrow it down to one piece of advice, it would be do eye exams. So many people overlook the eyes. We learned so much from this article that there were a lot of patients with eye disease. 20% beforehand had ear disease related to, or eye disease related to their ear disease, and then 30% had unrelated eye disease. So I think the biggest thing is just do eye exams. A lot of times you can find stuff either related to the condition you're looking at for the animal or even unrelated.
So then on the other side of the relationship, what's one thing that clients should know about ocular examinations before and after ear surgeries?
I think it's that eye disease isn't uncommon in these pets. And it's important that they're aware of that because clients are less upset about a complication if they're warned ahead of time. They know what to watch out for. They know it can happen. So if it does, they're prepared for that. And it's not a shock to them.
Well, thank you again for being with us, Bianca. This is really transformative information for veterinarians and for clients, and that's a huge accomplishment. So congratulations.
Yeah.
As we close down, we love to ask a fun question. And for you, what is your favorite animal fact?
My favorite animal fact, of course, it has to do with eyes. So cats only blink 1 to 5 times every 5 minutes. So you're probably always going to lose a staring contest if you try to pick one with them.
Okay, I definitely have tried that before. I have 2 cats that listeners know. Look how they look into staring contest. Yeah. I always, yeah. Oh, that's crazy. Thank you. Makes sense. I'm definitely going to go home.
Okay, a naive question. Is that with their third eyelid or like a true blink?
True blink.
Okay.
The default question, though. Well, thank you so much for being here, Bianca, and for sharing your knowledge of ophthalmology with us and our listeners, too.
Thank you. Thanks for having me.
And to our listeners, you can read Bianca's article in JABMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.